so thrilled to launch another weekly segment here on Studio 9. This one is really important. We call it Wellness Wednesday. Wellness Wednesday is focused on your overall health and wellness, both physically and mentally. And I have already booked doctors and health experts to come in and talk to us for the next 2 months. What health topics are you interested in? You can email us at studio9@WTVA.com. Now, here's a quick hint about what we're talking about in today's Wellness Wednesday. This is me wearing glasses as a child. I'm not sure how old I was in this picture, but I was looking quite fancy, I must say. And for all the little ones who worry about wearing glasses, hey, it helps you to see better, and it is a cool accessory. August is Pediatric Eye and Safety Health Month, and Dr. Ashley Pickering joins us live here in the studio. I am happy to see you.
We are too. Thank you for having me.
And thank you so much for joining us for what is a very important topic for parents. First off, how excited are you knowing that August is Child Eye and Safety Health Month?
I'm very excited. It's the perfect time to get your children's eyes checked when they're going back to school so they can see their best for the new school year.
All right, so now we're actually going to go through some slides here as to what you as a parent need to look for when it comes to your child. Now, the first one we're looking at, Dr. Pickering, explain this to us.
So when you're born in the hospital, you get a newborn screening. So the doctors check the baby's eyes. So everyone gets this. We also get screening exams at the pediatrician's well child visit checks.
And this is, for you know, is a healthy eye. So that's why everyone is so excited, because this is a baby. But unfortunately, that can change. Let's go to our next picture. This is red reflex. Could you explain that?
Yes, so one of the things that's checked in the child's screening is the red reflex. So we look at the baby's reflection with a special light. So you can see in this child, both reflexes are red, which is considered normal. You can also see this in photographs that are taken of the child. If we go to the next baby,
right.
So this child, you can see a whitening or yellowing of the reflex. This is considered abnormal. So this needs a full eye exam to rule out cataracts or retinal troubles or any other disorders.
All right. And how important is it for parents to make sure that they are looking at that?
It's very important. It's also getting checked by doctors and nurses every time your child goes to the pediatrician for their well child check. This is one of the checks that they do as well.
All right, misaligned eyes. Explain this.
So this child has a misalignment of their eyes. So you can see this eye is looking straight ahead, this eye is turned inward. So this is called strabismus. So this is very common in children. The eye can look up, down, in, out. And this needs to be medically or surgically corrected. This is not a cosmetic issue. This needs to be corrected so that the child can develop good vision, depth perception, have good social interactions, and further self-esteem.
All right, now we're going to talk about something I believe I had as a child, lazy eye. Could you explain this video to us? And I can hold the eye.
So in this video, you can see that one eye is focusing really well and one eye is not focusing well. So what happens is the brain will turn this eye off and it will not develop good vision, and it will use the strong eye. So this is why screenings are important, because this eye can look totally normal, but the child's not using it. So these screenings check for this. This also needs to be treated as a child, because if we wait till adulthood, the vision will not develop. So this is one of the very important things about screening.
Okay, and now we're going to look at a full sports injuries. Right now,
Yes.
Kids are getting active right now. What is it that a parent needs to look for?
Yes. So in America, one of the most common causes of blindness in children is sports injuries. Baseball is one of the #1 injuries. So when doing sports, a lot of these can be prevented by goggles, special glasses, or face mask. The special lenses that are the best are called polycarbonate lenses. So normal glasses or sunglasses can shatter and cause more damage to the eyes.
Okay, and before we let you go, we have a full screen in regards to myopia. Could you just explain this real quick?
Yes. So there have been some studies that show that children that play outside more have less progression or less worsening of their nearsightedness. So this is very important to encourage your child to play outside. Limiting screen time is good. And a good rule for children and adults is the 20-20-20 rule. So when you're doing near activities like phone or tablet, every 20 minutes you need to take a break, look at something off 20 feet into the distance for at least 20 seconds. This lets your eyes relax and it prevents eye strain.
All right, then thank you so much there, Dr. Ashley Pickering, for joining us right now.